also the author of the African American Spiritual. I'm sorry, you all. We're having just a little bit of difficulties. I'm going to start from the top again. Thank you for introducing me, Beza. And now I'm going to introduce Dr. Gloria Thomas, who is an assistant professor in social work at North Carolina State University. Dr. Anderson is deeply committed to helping underserved communities of color in healthcare decision making related to advanced care planning and end of life. For the past 13 years, she has worked exclusively with healthcare, hospice, and social service organizations. Gloria is also the author of the African American Spiritual and Ethical End of Life Care, entitled What Y'all Gonna Do with Me. And so today we're going to get into a little bit of dialogue on the impact of COVID-19 on African Americans and its importance of exploring goals of care. The objectives of this webinar today is going to be to explain current statistics on the high fatality rates of African Americans to COVID-19, to dispel some of the myths currently circulating in the African American community, and to provide historical content of the root cause of African American health disparities and how it correlates to higher risk of COVID-19 mortality. And last but not least, we're going to discuss how we can improve advanced care planning, conversations among African Americans. And without further ado, here is Dr. Gloria Anderson.
Hi, everyone. Can you hear me okay? Yes? Okay, great. Well, welcome to this webinar. And thank you, Terry, for your introduction, and thank Montgomery Hospice for the opportunity to work with you on this project. I want to thank each of you for being on the webinar as well. But we're just going to start with just looking at some of the current statistics. You probably already know that they are changing, so we'll go to the next slide. If possible, can Beza turn to the next slide? There we go. Yeah. So just based upon recent reports, it's clear that COVID-19 is hitting the most disadvantaged populations the hardest. Racial disparities along with chronic medical conditions are increasing that risk for the serious complications we're seeing with COVID-19, and it is resulting in higher death rates for African Americans and Hispanic populations. News reports are also showing that African Americans are experiencing the highest death rate to COVID, and although they only make up 13% of the total U.S. population, Blacks are now accounting for nearly 30% of total deaths in some states that are reporting ethnic and racial identities. So that's, again, this data is changing. Let's go to the next slide, please. The next slide. Thank you. As you can see in this slide, the Associated Press created a data chart to show the number of Blacks who have died from the virus by state. This gives us a closer look at the disproportionate number of deaths across the country. But look at Maryland in particular, with 153 out of 313 deaths being Black. And in DC, the number is 61 out of 80 deaths. Again, this was just a few weeks ago, and these numbers are changing rapidly. So this is just a ballpark of what the trends are starting to look like in regards to COVID and the death rates. Next slide. Can't hear. I can't hear it. Can you guys hear Terry?
Yes.
Okay, we could.
I think we're a little better now. Okay, I'm sorry. We apologize for that. We were in our experiencing a little bit of difficulty this morning. The question, Gloria, is why are African Americans more susceptible to COVID-19?
Okay, yes, most of you have probably heard that it's because of underlying health conditions or pre-existing health conditions or issues such as those that are listed on the slide here: obesity, asthma, high blood pressure, diabetes, and so on. But according to a recent article in Science News, there are other contributing factors to being more vulnerable to this virus, one of which is the type of occupations that many brown and Black people have. Many of them work in the frontline service work positions as nurses' aides, healthcare aides, grocery store clerks, restaurants, public transportation, and even package delivery, and so on. So these essential frontline jobs really force them out into the general public, where they cannot adhere to stay-at-home orders or shelter-in-place mandates. Another critical reason is that in many of these service-type positions, they don't have health benefits. Their employers don't offer health benefits. Some of them are part-time positions, for example. So being uninsured presents yet another barrier to healthcare access and affordable healthcare provision.
Thanks for that information, Gloria. What are some of the myths and misinformation calculated in African American community? What is circulated in the African American community regarding COVID-19?
Yes. There's so much misinformation out there, and a lot of people are still not realizing the deadly impact of COVID-19. The executive director of the American Public Health Association, Georges Benjamin, recently warned that this disease is a threat that African Americans really need to take seriously. But one critical concern is making sure that people get credible and culturally relevant information into the communities. And that means those trusted organizations and institutions like the churches. They need credible information and resources to disseminate to the people in the community so that they can have accurate information and avoid some of the deaths that we are seeing just because of lack of knowledge. Next slide, please.
That is so true. Yeah.
Yes, this is actually a quote from Georges Benjamin in an article in Undefeated just on March 13th. And it speaks to just what I was just talking about, how this misinformation is circulating in our communities, and we need to, and then a lot of Black people don't trust non-Black institutions. So that is an area. So we'll talk about that a little bit later, though. I know we've got some things to cover on that.
What are some notable root causes for health disparities in the African American community?
Well, we actually missed some of the myths that were. Can you go? Sorry. That's okay. I really wanted to point out some of those myths. Yeah, those are important because we're hearing so many different heartbreaking stories with families on video, and I'm sure you're seeing it in the news, where they're grieving the sudden loss of family members who were healthy and doing well, and all of a sudden contracted this disease and are now no longer with us. I just read a recent Pew research study that also reported that 4 in 10 Hispanic adults, about 39%, and about 34% of Black adults believe that the virus was actually created in a lab. About 26% of white people believe that as well. But looking at these 3 myths, and I only pulled 3, there's so many others, but these are some of the ones that really were circulating the most, or that I saw. And the first one is Blacks are immune to COVID. Some were thinking it wasn't even possible or anything to fear because it started in China, right? And so we're here in the United States, and so Black people just couldn't get it. But this disease has no respect to persons, and regardless of your ethnicity or your age or your socioeconomic status or any other differences that we might have, this disease can and will infect just about anyone. So the reality is no one is immune to COVID-19. Looking at that second myth on the slide about faith, this one can be challenging, especially for people of color who believe in God. Many African Americans hold strong religious beliefs and spiritual beliefs that often play a major role in how they live and what they do. And so Pew Research study showed that 83% of African Americans actually believe in God. And so about 75% reported the importance of religion in their lives, in their everyday lives. So when we hear of situations like the pastor in Virginia who died from COVID after having church services where social distancing mandates were in place, it's just very heartbreaking. It's heartbreaking to hear of these outcomes. This is not an either or situation. You can have faith in God and you can shelter in place. A minister friend and I were talking about this, and she said something that I'd like to just share with you, and it's a quote that she said. She said, "This is not a time to test God. It's a time to trust God." And I concur with that, and you may too. Lastly, the myth that you can tell if someone is sick just by looking at them. The truth is people are walking around with this and they don't even know it. So you can't just look at someone and know whether or not they are a carrier. I realize that we're social beings and that this is very hard for most of us because we can't reach out and touch and be physical and hug and support people in the way that we normally would do. But because we don't know, it's best that we not do that. And so I would say this is a time that we need to learn to love from a distance. And so those are the three myths I just really wanted to touch on for this webinar.
Thank you, Gloria. That's really good information. And the more we educate our community, the better. That is something that we're going to continue to do here at Montgomery Hospice through the faith-based communities and community centers everywhere we can. The information is very important for us to get out into our communities. And going to another topic of historical context, some notable root causes for health disparities to people of color.
Sure.
We're going to speak a little bit about that as well.
Absolutely. Well, first, it's important to know that health disparities toward Black people are not anything new. It's been going on for 400 years since the onset of slavery, where horrendous medical experiments were done on people of color, Africans, who were on slave ships coming to Virginia. So the real root cause of disparaging treatment is one that most folks don't want to talk about or think about, almost like end-of-life conversations in a way, and that's racism. Racism on the individual, institutional, and cultural levels. Racism is simply just prejudice, discrimination, or antagonism toward people or someone who is a different race on the belief that one's own race is superior. And racism is in medicine. It has always existed there. It is deeply embedded in institutions, in policies, and in personal mindsets. Laws and policies can be legislated. We know that. We've seen that over and over these many years, but no law or no policy can ever legislate a person's heart. So from a historical context, racism is the root cause of disparaging treatment. And like this COVID-19 disease, it's covert, not visible to the naked eye. And the worst thing about racism is that it can easily go undetected, not by those oppressed by it, but by those who don't believe that it still exists. I'll share a quick story of this happening in a healthcare situation. My mom told me when I was being born in the 50s, I won't say what year, but that she, in the South, she lived in Louisiana, she was in labor. They went to the hospital. They had a Black section where Black people were treated. She and another young lady were there in labor. They did not bother them for 10 to 12 hours. They laid there in labor, in pain, and there was no help to them. The young lady next to my mom actually died. And so that caused them to go ahead and deal with my mom. So I'm here because somebody had a heart to go ahead and do the right thing. But this type of treatment is something that is horrendous, in my opinion. And we need to do whatever we can to rid ourselves of this kind of energy. So according to Dr. Rodney Hood, there were only 2 times that provided better health outcomes or outcomes for health to African Americans. After the 13th Amendment in the U.S., the U.S. Constitution, I was looking at some of the comments, I'm sorry. But after the 13th Amendment was done to the U.S. Constitution, where the emancipation of Black slaves in December 1865 through the Reconstruction years, that's when the Freedmen's Bureau was implemented through the federal government. And that's when Blacks were helped through they helped themselves by building their own hospitals and schools and other institutions that served their families and the needs of their families and communities. That did not last very long because there was not much support to that effort. Another time in history where Blacks actually fared better in health disparities or not having health disparities as much was during the civil rights movement in the 1960s and the momentary opening of the middle class of America, where many African Americans were able to gain access to some of those resources and opportunities that were predominantly reserved for whites only. So these are just a few of the historical roots. And someone wanted me to talk about the 1935 New Deal legislation. Well, when that New Deal came about, many of the people that were excluded from that New Deal, especially with Social Security, they were Black people, Black and brown people. I can't remember the numbers, but I can provide that to you later. But it was about 75% of the people of that day working in service-oriented positions, either service of farming or household work or whatever, servant positions. And none of those positions were covered for Social Security until the 60s, when it was modified or amended. So that right there gave a head start to other people and not to the black community in terms of even having Social Security benefits or even some of the union affiliations where they could be under union contracts, where they would have union coverage, if you will. So there's a lot to this. I can tell you a resource that I found very helpful, and I would recommend, and I think it's in my reference list. It's a project called 1619 that is in the New York Times has started in last August, and it gives a very detailed narrative of how these injustices have happened from the time of slavery. So I highly recommend just looking at that. We don't have time to really delve into more of that, but I'm certain that you would really appreciate looking at that. And some other sources are also being added to the chat that I can see. I would just highly recommend that, looking into those for further information. Terry?
Thanks a lot, Gloria. That was some very good information. Thanks a lot, Gloria. That's some very good information that you're able to continue to share with us. And I'm sure a lot of us on this webinar right now can relate to some of the stories that Gloria has been talking about within our own community and our families.
Yes. Well, I wanted to show this slide, which is more of a contemporary look, a stance of what is happening right now. In relation to what has happened, the historical factors that I just discussed on the previous slide can be looked at on this slide from a more contemporary stance, or that shows some of the current disparities people of color are still experiencing even today. Black Americans are more than twice as likely as whites or Asian Americans to live in poverty. Infant mortality for Blacks is twice that of whites. The unemployment rate is twice that of whites. And Black Americans also have the highest death rate and the shortest survival of any racial or ethnic group in the U.S. for most cancers. But lastly, I really want to point out the Blacks in that last column, in that last column, I really want to point out that Blacks often report that medical professionals take their ailments less seriously when they seek treatment. which speaks to the mistrust issues that many people of color have when it comes to receiving equitable health care.
Again, I think this is another point where when something like this is being read aloud, it really resonates.
Yes. Well, what I like to do now is kind of do a little bit of different, take a little different turn here as we get close to the end of this part of the webinar. But I wanted to share this after I read this story in the New York Times just 3 days ago. I thought it would be good for like a case study for us to look at something together as an example of how the past connects to what we are witnessing with COVID-19 and the disproportionality of African Americans dying to this disease. So I chose Detroit because Blacks compose 79% of the local population there, and from the recorded COVID-19 deaths and cases, 88% of them are Black people. Now, I want you to read the quoted headline out loud if you can. I'll say it out loud. Terry can say it out loud. And if you can't, that's okay. We can understand that. But let's just read that together, and I'll read it now. In Detroit, virus or no virus, many people have a job they need to get to, and one way to get there. The bus. Thank you. Now imagine for a moment, go back, Terry. Go back to the previous slide. Yes, I want to keep it there for a second. So now imagine for a moment that you are living in an area like Detroit that has a high density of people and that social distancing is not really an option. Okay, then I want you to add to that, imagine that you are an essential frontline worker who is making a minimum wage in Detroit, which is $9.65 an hour, and that just went up in January. Imagine that you don't have a car and you have to rely on public transportation to get to work and to go buy food. Now imagine that you don't have any health insurance and no access to health care, even if your family or your family member is sick. Imagine those conditions for just a few seconds, if you will. Okay. Now, as professionals in the helping world, most of us can imagine for a moment what that might feel like and what that might look like to be in that type of situation. But most of us, we can also quickly unimagine it too, right? For it's very unlikely that that scenario is our reality. Now the next slide, please. Thank you. But when you look at these statistics or look at this information, we can't deny that this is the reality of many working class people, not only in Detroit, where they make up 14% of Michigan's population, but account for 40% of all COVID-19 deaths, but also throughout the entire country. So I hope that this is helping all of us to better understand that just having the pre-existing health conditions or the comorbidities is only a tiny fraction of the real cause of why COVID is impacting African Americans and Hispanics disproportionately. Next slide. So when we
now we're going to go on.
Oh, okay. Go ahead. I was just going to.
Oh, that's all right. I wanted to pose a question to you, Gloria. What are some of the things that we can do to change this narrative?
Well, let me think. So I would first want to just say this. This is no ordinary time, right? And I believe it calls for extraordinary measures. And that begins with all of humanity realizing that none of us are better than any of us, and that we all fare better when everyone's needs are met in a socially just society. I believe that we must do whatever is necessary first. When you say, what can we do to change this narrative? I believe that we must do whatever is necessary to erase the mythology and the belief that there is a superior race, and that needs to be eradicated on the individual, institutional, and cultural level. It's a tall order. I get that. 400 years in the making. But the reality is we're all one human, one humanity. And what better time than right in this world-changing moment of a pandemic to become a changed world? It's time to come together as the collective humanity that we are. I also believe that this pandemic is a wake-up call to all people to get back to the basics of our social work value of human dignity and worth of the person, and start living in harmony together. And more than anything, start loving one another as we love our own selves. So that is what I would respond to there.
Thank you. Thank you so much. And now one of the things that we're going to talk about, and which is very most important in our community, is health disparities at the end of life. This is a topic that we absolutely have to pay more attention to in our community.
Yeah. Are you wanting me to?
And so,
let's see.
Yeah, if you wanted to talk about that a little bit prior to going to the next slide, that'd be great.
Well, I was going to actually talk from that because you said what are the side effects.
Okay.
Yeah,
okay.
I wanted to just really, because health disparities at end of life actually are centered around those, many of those barriers. So if you could put that next slide up, I'll just kind of talk to those points. Yeah, some of those barriers to hospice. Yeah, that's good. Thank you. Technology, it's something, right? So anyway, thank you guys for being patient with us as we kind of navigate this. But yes, when you think about some of the barriers that are to the hospice use for African Americans, first, I would say the lack of knowledge about hospice is an issue. There's a lot of misinformation out there about what hospice is and what it does. There's a lot of, for example, one of the things I've heard, and I've heard it over pulpits where pastors have even said this, that hospice is a place where you go to die. Now, that's not it, but getting information out that dispels those types of myths, I think is very important, and that is a strong barrier, just having misinformation or the lack of knowledge of what hospice and palliative care offer as options. When we look at the general mistrust of the healthcare system, again, you know, we know that happens because of the things I've shared already, but that is a barrier. That is a barrier. And getting past that, we have to develop ways to encourage trust or to build trust. And trust is not something that is automatically given. That's something that is earned. That is something that comes from relationship. And so I feel that the health system has to help with this. It's not us as African Americans having the mistrust. We have justification for that, and it's documented all through the literature. However, what can healthcare systems do to remove those barriers? And one would be even to listen to what people are saying when they come, to give them options, all the options that they offer to other non-Black people. For services, for cancer options, for other options, those types of things. So that part of it is on the side of the healthcare system's responsibility. On the spiritual belief side, that is a barrier sometimes because, you know, medicine and theology don't necessarily marry to each other. So people's belief systems, as I mentioned earlier, 83%, based on Pew Research, African Americans believe there is a God. So if you omit God in your communication with that particular belief system, then you are putting a barrier between the service you can render. So we can talk more about that maybe from the audience as well, but those are just some of the barriers that I wanted to point out. I can't hear you, Terry.
Those are good Those are very good topics right there. It kind of reminds me, I never forget, I'm going to tell a little short story of my own when it comes to my church. Our pastor, his wife, she was ill with something, and of course, they were determined that they were not claiming it. And he was in the pulpit and he stated, "Who are those people who come to watch you die?" And all of a sudden, someone said, "Hospice." He goes, "Yeah, them." And so at the end of the service, when he met everybody at the door, I walked up to him and I said, "I'm one of those people." And so it just, it was just funny. So from there, I was able to have a teaching moment.
Yes, yes. Wow.
The teaching moment in the congregation. So sorry for diverting a little bit, but I just had
That
to
was
share
great.
that
Yeah.
information. Uh, and so now we're going to move to the impact of COVID-19 on African Americans and the importance of exploring goals of care, which is huge. It's
Yeah.
really huge, not only for this time that we're in, but beyond, because we will be getting through this COVID-19 epidemic. So, Gloria, given the historical and cultural context of mistrust in the healthcare system, how can African Americans ensure that the values and goals that guide their healthcare wishes are met?
Wow. Yeah. With all of the barriers that we just discussed, um, for African Americans to ensure their own values, I believe that they have to have good information. I think that they have to have information that's culturally relevant, that's credible, and that it applies to them, that gives them the options in language and terms and scenarios that they can relate to. That will help guide the value part of that. You can select what you need based upon what you need, and knowing what those options are from a from a perspective that that speaks to you, that speaks to your language, speaks to where you are. I think that's very important. It's very difficult to ensure your own values are met when you don't have information that's appropriate to make decisions from. So ensuring those values, I think, begins basically with having the right type of information about what my options are, and then some guidance as to how those can best benefit my life.
Great. And how can we improve advanced care planning conversations among the African American community to ensure goals of care are met, especially during this pandemic?
Yes. Well, to improve the conversation in light of this pandemic, it's always been an important conversation to have with all people. We recognize that. Improving that conversation, though, I think begins with starting in the community itself, communicating the need to establish and respect the community stakeholders who have the platform to provide information to the community. For example, encouraging and established the trusted leaders of a community, like pastors, for example, in church settings. That's a safe platform that we could improve the conversation by ensuring that they have information to give to the congregants or to their communities, to help them better understand, here again, their healthcare options, including advanced care planning. And then just providing, to improve that conversation, just to provide the families and caregivers themselves the culturally relevant materials to help them navigate the medical terrain, if you will, of healthcare options and end-of-life care options that would be best for them. And I'm sure the audience has some other ideas on that, and I'd love to be able to hear. I can't hear anything or see any of their comments, but I would love to hear what they would say in terms of how we can work to improve that, how we can change the narrative even here. I think the last statistics that I saw show that only 8% of African Americans utilize hospice care as compared to like 83% of whites. So the need is there. You know, lots of times, and I'm not sure if this is scripted or not, but many times um, um, hospice is looked at in a negative way because of that misinformation. So yeah, we need good information out there, and we need to get it to the people that are trusted to share that information.
So what we're going to do now, we're going to continue to talk together to create socially just society for all of us. By coming together as collaborative humanity, we are.
So are there any questions that are coming in that we could address?
So this is Beza jumping in again. If you have any questions, please go ahead and type them in the chat box. I think you all have been sharing some really great facts in terms of just what is resonating with you. So you have Gloria. We're here for another 20 minutes. So if you have some specific questions that you would like Gloria to address, now is your opportunity to do so. If you'd like to ask her live, I could unmute you from my side, so you can just raise your hand or type in the chat box that you would like to ask a question, that you'd like to ask a question directly to her. I'm gonna give you a few minutes to just go ahead and
Can you guys hear me still?
Yes, we can hear you.
Okay, Rachel, you have a question. I'm going to go ahead and unmute you right now. Bear with us as we try to figure out, you know, this remote learning technology is tricky. Okay, Rachel, go ahead and ask your question.
Okay. So this makes a lot of sense, but I'm an elderly white woman, and I'm a social worker, and I'm wondering how I incorporate this into the treatment of the person sitting in front of me.
Good question. So did you hear that, Gloria?
Yes, Rachel. Yes. Here's how I see anybody using information like this. When you have knowledge, that is power. So knowing a history helps you better understand some of the behaviors, perhaps, or responses to people of color that you might work with. I would say that the thing that comes to my mind first is that you are the instrument that is placed there. You are the change agent that is placed there to help the people that you serve. You being who you are and genuinely showing concern, those are the things that matter. People look for caring, compassionate, empathetic support. You don't have to be of the same ethnic group to offer that to a person. And so as far as how you use that, I say you take that information, anything that's here that is helping you better understand a cultural norm and understand that we can't generalize these concepts to every person. That would be not the right thing to do, but take whatever parts of it that make sense for you to better understand the cultural differences, and then just be honest. If you don't, know what to say to facilitate, You can just say, I'm not really sure what I need to say, but just being honest and genuinely who you are comes across way much, much, much better. I know that's not really professional, but it comes across so much better. It comes from the heart, and people appreciate genuineness over intelligence or knowledge. I hope that helps.
Absolutely.
Absolutely. And I think
that's
a
a reoccurring theme that we hear from a lot of our speakers is that the
importance of being honest,
especially in this industry, at least end of life, trust is huge. We work with those who have advanced illnesses, who are aging, and end of life itself is very sensitive, and people are looking for people who they can trust, and so that is definitely something that I would also reiterate. That's a very good question. We have another one from Crystal, so I'm going to go ahead and unmute you now, Crystal, so you can ask your question.
Okay. Crystal, you can go ahead and ask your question. Looks like we are not able to connect with her, but I do have another one here. Do you have advice for facilitating respectfully conversations when faith is brought up, when there is not a shared belief in God?
Yes, I would say if you, and that happens, I said 83% of African Americans show some type of belief in God, but then that's 17% that doesn't. So if somebody doesn't share the same, this is part of what I mean about coming together as a collective humanity that we are. We are individuals. We don't all believe the same thing or the same level. And I believe that here again, just respecting those differences. I don't have to agree with what you believe in order to converse with you. I don't have to believe, and you don't have to believe what I believe in order to serve me or to give me a care. It's more about respecting the differences and appreciating the differences, not to compare or to compete or to say yours is right or mine is wrong. I think those are the kinds of arguments that get us off course and that we spend too much time already dealing with. When we're in the middle of a pandemic and people are dying all around us and we can't even touch out and love, and we can't funeralize people, we can't be with people who are dying. This is a very traumatic time and moment in our history. I say wherever you are, wherever you're planted, that you be the best you that you can be. And that means to let the love that's in you come out to other people, and not worry so much about what they believe or what they don't believe. Acknowledge what people believe. If they bring that up, acknowledge that, but you don't have to agree with it to care about them. I hope that answers that question.
Very helpful.
That is definitely helpful, very helpful. I believe that there is an echo that you guys are hearing from my end. I hope, do you still hear that echo?
No.
Not much better. Okay, great. As I said, we are definitely, trying to figure this technology out from our end. And I really do appreciate all of you for bearing with us as we try to figure this out. You all have some fantastic questions. Keep them coming. We still have 12 minutes. In the meantime, I'm going to go ahead and share a link to an evaluation form. Your feedbacks are absolutely important to us, so please do take a moment to complete that evaluation form. We actually read those feedbacks and try to incorporate them in the programming that we do here at Montgomery Hospice. This is one of our Center for Learning programs and it would count as an elective towards the certificate in end of life. So as you think, as you're quarantined at home, if you are looking for something to do to get through it, maybe this might be a good program for you. It's definitely affordable, and we have some terrific programs and terrific speakers and moderators as these two ladies that I have the pleasure of having here with us today. So it looks like don't have any questions from you all. I want to take this moment to sincerely thank Gloria for joining us. I'm sharing some of the references here, and for Terry for moderating this important discussion. The reason why we're doing these series is that we know how important and relevant these conversations are, especially during this time. And so we are going to continue to provide these community dialogues in the coming weeks. We have next week we're doing one on the Latino community, which is also very much disproportionately impacted by this pandemic. So we would continue this conversation, and we would try to bring you as many relevant conversations as possible. We also really want you to share this information with your colleagues, with your friends, with your family. That's the one of the points of providing education that that we do through the Center for Learning is for you to be able to share this information. But we do ask you to contact us before you share this information. If you'd like to share the PowerPoints for a permission, so that way we could give you that from our end. So with that said, I am going to go ahead and oh yes, so there is a question about resources. All resources disclosed in this webinar, as well as this PowerPoint and other resources that we might think would complement this this presentation, would be shared to you via a follow-up email. One thing that I want to share with you right now, is that Montgomery Hospice just started a Faith and Comfort. On our website, we have started a Faith and Comfort Corner, and it is a fantastic place where you can go and share some of those self-care things that you're using to get through this difficult time. If you have a chance, go ahead and visit it. It's on our website. It's up and running. So with that said, I am going to go ahead and end now. I hope you enjoy the rest of your week. And yeah.
Beza?
Yes.
Hi. Before we, thank you. I just wanted to say thank you, everybody, for being on this webinar. I know we're social distancing and sheltering in place, but I do want to encourage you to take time to rest and to connect with others, to encourage them and to get encouragement from them. We're all in this together. Thanks for your caring and courageous doing of this work that you're called to in this hour. And I wanted to also let you know that I do have a resource, the guide that Terry mentioned at the beginning, that is being used to help give information to African American families and communities around how to have this conversation. And so we can make that available to you as well. But yes, we just have to encourage each other in this season. So thank you again, and I appreciate the opportunity to be a part of this. Thank you.
Thank you so much, Gloria. If we weren't able to get to your questions, we apologize, and I'm definitely going to send any questions that we missed to Gloria so she can respond to them, and we'll include them in the follow-up. So have a good day. We're going to go ahead and end here.